In a world still reeling from the impact of a global pandemic, the thought of another, even deadlier pathogen is the stuff of nightmares. But what if I told you that such a virus already exists? A virus with a staggering fatality rate that can reach as high as 75%. This isn't a hypothetical scenario from a science fiction movie. This is a real-world threat, identified by global health organizations as a major concern for future pandemics. It is called Nipah virus. Nipah virus, or NIV, is considered one of the most dangerous emerging pathogens known to science. Its combination of high lethality, a natural reservoir in common wildlife, and the proven ability to spread from person to person places it in a special category of viruses that demand our utmost attention and respect. The World Health Organization has designated it a priority disease, signaling its potential to cause a public health emergency. To understand the threat, we must first understand the virus itself. So what exactly is Nipah virus? Scientifically, Nipah virus is an RNA virus belonging to the Paramyxoviridae family, a group that also includes more common viruses like measles and mumps. However, Nipah is part of a much more dangerous genus called Nipah virus. It is classified as a zoonotic virus, which is a critical term meaning it originates in animals and can spill over to infect humans. This animal-to-human transmission is the spark that ignites outbreaks. The world first became aware of this deadly agent in 1998. An outbreak of a mysterious illness swept through a community of pig farmers in Malaysia. Initially mistaken for Japanese encephalitis, the disease caused severe brain inflammation and respiratory illness with an alarming death rate. It was only after intensive investigation that scientists isolated a completely new pathogen. They named it Nipah virus, after the village Kampung Sungai Nipah, where the first human victim was identified. This initial outbreak resulted in over 100 human deaths and the culling of more than 1 million pigs to contain the spread, revealing the devastating potential of this new virus. Since then, subsequent outbreaks have been recorded almost annually in Bangladesh and periodically in India, each one reminding us of the persistent threat lurking at the intersection of human and animal life. To stop a virus, you must first find its source. For Nipah, the trail leads to the skies. The natural reservoir or primary host of the Nipah virus are fruit bats of the Pteropus genus, more commonly known as flying foxes. These bats are found across Southeast Asia, South Asia, and Oceania. They are essential for pollinating plants and dispersing seeds, playing a vital role in their ecosystems. Crucially, the bats themselves do not get sick from the virus. They are asymptomatic carriers, meaning they can carry and shed Nipah for their entire lives without showing any signs of illness. The virus is present in their urine, feces, and saliva. The danger arises when these bats forage for food near human settlements. As they feed on fruit in orchards or trees, they can contaminate the fruit below with their excretions. This is where the spillover event begins. In the first Malaysian outbreak, it's believed that pigs on farms built near these orchards became infected after eating fallen fruit contaminated by bat saliva or urine. These pigs then acted as intermediate hosts, amplifying the virus and passing it on to farm workers, triggering a large-scale human outbreak. Understanding how Nipah virus spreads is key to preventing infection. The pathways are alarmingly straightforward. The first route is direct contact with infected animals. This includes touching the bodily fluids of infected bats, or intermediate hosts like pigs. The second, and a major cause of outbreaks in Bangladesh and India, is through consumption of contaminated food. The prime culprit here is raw date palm sap, a popular local delicacy. Bats are attracted to the sweet sap as it's collected from trees, often overnight, and can contaminate it with their urine or saliva. When people drink this raw, unpasteurized sap, they are directly ingesting the virus. But perhaps the most concerning transmission route is human to human. Once a person is infected, they can pass the virus to others through close contact with their bodily fluids. This includes saliva, blood, and respiratory droplets expelled when coughing or sneezing. This mode of spread is especially dangerous in healthcare settings and within families caring for sick relatives, where close, prolonged contact is common. The ability of Nipah to jump from person to person is what gives it pandemic potential. A virus that can sustain transmission within the human population is a far greater threat than one that only spills over from animals occasionally. Once a person is exposed to the virus, there is an incubation period that typically lasts from 4 to 14 days, though in some rare cases it has been as long as 45 days. During this time, the infected person may feel perfectly fine, yet the virus is multiplying within their body. When symptoms do appear, they often begin deceptively, mimicking a common flu. The initial phase includes a sudden onset of high fever, severe headaches, and myalgia, which is intense muscle pain and body aches. This is often accompanied by fatigue, nausea, vomiting, and a sore throat. Because these early signs are so nonspecific, a correct diagnosis can be delayed, allowing the virus more time to attack the body and potentially spread to others. However, this flu-like stage is often just the prelude to a much more terrifying progression. In many patients, the disease rapidly advances to affect the central nervous system. The virus can cause acute encephalitis, a severe and life-threatening inflammation of the brain. As the brain swells, patients can experience dizziness, drowsiness, disorientation, and mental confusion. The condition can quickly deteriorate, leading to seizures and plunging the patient into a coma within just 24 to 48 hours. Some patients also develop severe respiratory distress, requiring mechanical ventilation. This combination of neurological and respiratory failure is what makes the disease so incredibly deadly. Just how deadly is Nipah virus? The numbers are grim. Across various outbreaks, the case fatality rate has ranged from 40% to a terrifying 75%. To put that in perspective, the fatality rate for COVID-19 is estimated to be well under 1% for most of the population. For Nipah, in some outbreaks, 3 out of every 4 infected people have died. And death is not the only tragic outcome. For those who survive the acute phase of the illness, the road to recovery can be long and arduous. Many survivors are left with significant and often permanent neurological problems. These can include persistent convulsions, memory loss, cognitive difficulties, and drastic personality changes. The virus can also remain dormant in the body and reactivate months or even years later, causing a fatal relapse. This devastating toll on human life is why the World Health Organization has classified Nipah virus as a priority pathogen, a distinction reserved for diseases that pose the greatest public health risk due to their epidemic potential and for which there are no or insufficient countermeasures. When faced with such a deadly virus, the immediate question is, how do we treat it? The answer is deeply concerning. Currently, there is no approved vaccine to prevent Nipah infection in humans, and there is no specific antiviral drug to cure it. The research is ongoing, with several vaccine candidates in development, but we are likely years away from a widely available, effective shot. Treatment, therefore, is limited to intensive supportive care. This means managing the symptoms as they arise, controlling fever, preventing dehydration, providing respiratory support with ventilators for patients with breathing difficulties, and managing neurological complications like seizures. The goal is to support the body's functions and give the immune system the best possible chance to fight off the virus on its own. In the absence of a cure, prevention becomes our single most powerful weapon. And prevention starts with awareness. In areas where Nipah is known to exist, the primary strategy is to reduce the risk of animal-to-human transmission. This involves avoiding contact with sick pigs and, most importantly, with fruit bats. A critical public health message in these regions is to avoid consuming raw date palm sap. If it is consumed, it must be boiled first to kill the virus. Fruits found on the ground should be washed thoroughly or discarded. For healthcare workers, the risk of human-to-human transmission is paramount. Strict infection control protocols are essential. This means using full personal protective equipment, gloves, gowns, and respiratory protection, when caring for a suspected or confirmed Nipah patient. Isolating infected individuals and practicing rigorous hand hygiene can break the chain of transmission and prevent a small outbreak from becoming a large-scale crisis. While outbreaks have so far been confined to South and Southeast Asia, the risk is global. In our interconnected world, a virus is only a plane ride away. The potential for Nipah virus to cause a future pandemic is a subject of serious discussion among epidemiologists. All the necessary ingredients are there: a high fatality rate, a natural host that is widespread, and the proven ability to spread between humans. Scientists warn that the virus could mutate to become more easily transmissible. If a more contagious strain of Nipah were to emerge in a densely populated area and spread internationally before it could be contained, the consequences would be catastrophic. This is not fear-mongering, it is a calculated risk based on scientific evidence. Constant surveillance, rapid diagnostic capabilities, and investment in vaccine and treatment research are not optional. They are essential components of our global biosecurity. The story of Nipah virus is a stark reminder that our health is inextricably linked to the health of our planet and the animals we share it with. Awareness is the first and most critical step toward prevention. By understanding the risks and knowing how to mitigate them, we empower ourselves and our communities to stay safe. The threat is real, but through science, vigilance, and collective action, we can work to ensure that Nipah virus remains a contained, regional threat and never becomes the next global pandemic. If you found this video informative and important, please help spread awareness by liking and sharing it. And subscribe to our channel for more deep dives into the science and health topics that shape our world. Stay informed, stay cautious, and stay safe.